As I told you, when we do a lumbar fusion or a lumbar decompression and fusion, so the first part is decompression, which I have shown you. It can be in all various types, right? Now is the part of fusion. So for fusion, there can be fusion without instrumentation and there can be fusion with instrumentation. Usually the techniques of fusion without instrumentation is past gone. It's no more use except it's in infected spines or spines which are not fit for the instrumentation. So how does it look like when we do instrumentation on the spine? So this is again another part of the another kind of the model. So this is the vertebrae. Here is the screw which is going inside the vertebra, as you see, right? And then the part of the disc which is diseased or torn or degenerated, so we remove it and we replace it with the artificial disc-like structure which is known as cage. And this cage is made from various kinds of material depending on the need. And when we have to fuse one level, so this is one level fusion where there are 4 screws, 2 on each side, and this is connected by the rod, right? So the fixation is done this way. Now the part is fusion. So fusion can occur either it has to be done anteriorly, which is interbody, so we remove the disc and put a cage, as I told you. The second part is a posterolateral fusion, bony fusion. So we make the structure, we remove this part because the decompression has to be done, as I told you before. So when we remove this part of the bone, we collect it and we make a nice bone meal, and then we put it here on the side of the screws, which forms another bone which leads to the fusion. So that is what is decompression and fusion. If this is what it is in the single level of decompression and fusion. If it can be a multiple level, it can be 3 levels or 4 levels. Usually in lumbar spine we do 1 to 5 levels depending on the requirement, depending on the degeneration, the number of levels. Now the fusion of, as I told you, the interbody fusion that can be done in 2 ways. If we do a transforaminal, then we have to remove this part of the joint and we go directly from the side without touching the dural tissue. Dural tissue is the tissue around the nerve root, it's a protective tissue. Or we can just retract it and we go from the center and then replace the disc with a cage. So these are the 2 types, which is known as a PLIF or a TLIF. Here I would say this is grossly what is can be spoken about lumbar decompression and fusion. If there are any more queries, you can go to our website and see the literature further, and we can clarify you on a case specific basis. Thank you.